Hello, hello. Welcome to my workshop, Power of Attorney Preparedness in Illinois, a healthcare administrator guide for family and facilities. Oh, ooh, gonna turn that off. Sorry. Welcome to my workshop, Power of Attorney Preparedness in Illinois, healthcare administrator guides for families and facilities. My name is Leander E. Alexander. I am a independent healthcare administrator and public health specialist, CEO and founder of Edward Lee Consulting. I work with different nursing homes and long-term care facilities to provide solution-based strategies for upscaling their census, marketing, and business, all through data and human-centered care approach. So today I really wanted to bring to you this workshop where we're going to be talking about the power of attorney, specifically as it pertains to Illinois. And now, as a healthcare administrator with experience in long-term care risk management and care coordination across Illinois, I understand a lot of the issues that nursing homes and long-term care facilities are facing, especially when we talk about patient care, revenue management, fines and regulation. So part of what I want to do, or why I started Everly Consulting, um, is I really want to help facilities and healthcare professionals really succeed in building and marketing their facilities. Um, Today we're talking about something that's been overlooked until it's urgent, and that's the power of attorney paperwork. Okay, so this workshop, just to be mindful, this workshop isn't about legal advice. I am not a lawyer. I'm not trying to get legal advice. However, I am a healthcare administrator who has experience working with these matters, especially when it comes to power of attorney, guardianship, and things of that matter. Um, and usually, like I said, it's usually when it's urgent matter that these issues come up. So the purpose of this workshop is to make sure that you and your facility and your patients are prepared in those matters. So I'm not an attorney, but I'm here to guide you through the importance of a POA form of the power of attorney from a public health and healthcare perspective. Whether you're a caregiver, a facility staff member, or someone supporting an aging family member, this workshop is great for you. Okay, so let's get to work. All right, so a little bit about me. Again, my name is Leander E. Alexander, healthcare administrator and consultant and public health specialist. I'm the CEO and founder of Edward Lee Consulting. I have over 15 years of experience in healthcare with 10 years in management. I started out as a case manager in Social Security Disability, worked in nursing homes where also worked in management, a social service director and admissions director. I've worked in homeless management and case management, community case management, non-for-profit government sector, kind of different, really every different aspect of the healthcare field, and public health field. I have a bachelor's of arts in sociology. Sorry, I forgot to put that. Bachelor of Arts in Sociology from Colgate University. Graduated in 2012, and I received my Master's of Healthcare Administration from Colorado State University Global Campus in 2019. Experience working in long-term care, psychiatric facilities, community organizations, hospitals, clinics, government agencies, public and private sectors. Again, from management service line, program development, risk management review, audits, all of that. And my skill set is in risk management, program and service development, and support, just to name a few. But that's mainly what I'm going to be speaking about and focus on through me on service through Everly Consulting. But enough about me. Let's get to the presentation. All right. Power of Attorney Preparedness Illinois, a healthcare administrator guide for families and facilities presented by moi. All right. So let's start off. What is power of attorney? Okay. Power of attorney, abbreviated as POA. It is a legal document that allows a person, the principal, to appoint someone, the agent, to make decisions on their behalf. All right. So this is very common in elder care, long-term care, in hospital settings, nursing homes, short-term rehabilitation centers, assisted living, supportive living, senior care communities, long-term care hospital wings or hospice patients, home health. This is also good for home health. Um, uh, staff and agencies as well, because you need to know who you're going to be talking to, and who's regarding the care, the coordination of the patient's health, who's going to be making the decisions. So there are two major types of power of attorney in healthcare. I mean, in Illinois, sorry. So in Illinois, there's the healthcare power of attorney. This allows someone to make medical decisions if the principal is unable. Okay. So again, a very important thing about all types of power of attorney is the person, the patient must be cognitively able to make decisions in order to sign, because it's going to be the patient signing the form. Okay. So in order for the, so it's the patient who is the principal, who is saying, within their cognitive abilities, they're stable, they're able to make decisions. I want this person, in case something happens to me, to start making decisions on my behalf. So it's very much a um, preventive manner. Okay, you have, the patient has to be cognitively able to still make decisions. If the patient is not cognitively able to make decisions, they cannot use this form. Okay, why? Because they can't legally sign. In order for a signature to be valid and legal, the person must be um, cognitively able. How do you find out if your patient is cognitively able to sign? Usually, there's neuropsych testing, or the psychiatrist or the mental health provider. Sometimes, in case the medical provider can help decide that through assessments. In long-term care, I know with neuropsych, getting those exams or evaluations, sometimes there's a wait list of a year or two. Um, so a lot of times with long-term care professionals like the nursing homes, you all can use the BIMS assessments, and the different social service and documentation from staff to kind of determine, um, use your good judgment, if the patient will be able to sign. If in doubt, I would say don't do it though. Okay. But again, this is something also too that you want to leave to the family. So I always, one of my rules is, when in long-term care facilities, what the staff should do is, it's okay to present them and educate them, but stay just kind of like the education, educating them what it is, how to do it, what's legal, how the process works. But in terms of getting into their personal matters of who should do it and helping them choose, you do not want to touch that. Okay, that's going beyond your bounds and placing you in the facility in great liability. So you just want to educate them on what it is and how to go about getting it established, which is the purpose of this workshop. So healthcare power of attorney allows them to make medical decisions. In Illinois, there's something called a property or financial power of attorney. It's basically called the property power of attorney. So again, Illinois has its own standard forms. Very important to use correct versions. Illinois, the state Illinois government actually has standard forms for each one. They have a standard form for the healthcare power of attorney for healthcare, and they have one for property, a power of attorney. It's not going to say financial, it's going to say property, but property includes all financial matters. That includes banking, trust, land, assets, and stuff like that. So that's why they just label it as property. If you go, there's two standard forms you can use. You can actually download them for free. If you Google the different, you can actually Google the popular one is healthcare POA, and the power of a financial power of attorney. Um, you could Google that too. Let's do property POA Illinois to get that one. But if you do Google healthcare Illinois POA, usually the PDF pops up. It's usually like the first or second link. I would say save that, print it out, have a few copies in your office. Because again, if you have a family or a patient who wants to get that done, you could just present it to them. Um, okay. So why power of attorney matters in healthcare settings? Okay. Power of attorney is not just for end of life. It's used during surgeries, hospitalizations, or dementia related events. Okay. Without power of attorney, families may face delays in decision making. Okay. So what's very common, what I see a lot in my line of work is, let's say you have a patient, they're good, they're able to make their decisions, And then, of course, a medical event happens, whether it be a stroke, a heart attack, a trauma incident like a car accident or what have you, where um, not only are there medical, um, physically, medically affected, but there's some cognitive impairment as well um, as a result of the medical event. So it means they might have you might find them having to decrease cognition or able to make decisions like they used to, like we see with post-stroke victims or post-brain trauma victims. Um, so that's usually where a power of attorney would be helpful. However, remember in that aspect, you can't do a power of attorney because once the person becomes not able or not considered cognitively able in their right mind, which means they don't know who they are, where they're at, their attention goes in and out, confusion. They can't sign the power of attorney anyway. So if you're find yourself in that um, find yourself in an event like that, unfortunately, the power of attorney wouldn't really work for you. You actually have to go to guardianship, which is a whole other process. So again, power. So why is this important? Not just for in life. So this is important to a conversation to have with your current patients now, um, regarding to having this in place. Okay. Again, it's not. We'll get to that a little bit. The guidelines, but it's very important to have this in place so in case of emergency does happen, then there'll be something in place. The patient could get decide beforehand because remember, this is a preventative measure. The patient can decide beforehand in case something happens to them where they can't make their decisions or medically or financially. They can have the proper paperwork in place to assign the person to do that. Okay. Now, keep in mind, they also don't have to do both at the same time. Maybe they just want to do a health one right now. Maybe hold off on doing the property one. Maybe they didn't want to do a property one right now. Hold off on doing the POA. I highly recommend doing both just to have it in place because, again, anything, something happens, you'll want to have that in place. Um, Facilities and providers are going to be limited in how they respond if they don't have the proper power of attorney documentation in place. Okay. Again, how many of us in the industry have come across patients who are in medical need or having a medical event, not able to make decisions, but you need decisions to be made about care, but there's no power of attorney in place. Okay. So you might have to be talking to several different family members, friends, or whoever about what to do with the patient, and then don't let them be fighting. Okay. If they're fighting, it's a mess. So this is something that's really can be useful for staff to help you alleviate all those issues that you will face. Okay, this is why I say for every patient, especially long-term care, you want to have a power of attorney for health, at least health, in place. Okay. I would say with finance too, especially if they have large trust or large amount of money, I would definitely say that have that in place too, because again, if something medically happens, and then we work in facilities in our line of business where, we want the patient to be stable, but guess what? Medical events do happen where the patient does decline, and in a decline, they might not be able to make decision as such. So having these things in place protects the patient and protects the facility from all that fuss and hoopla that could go on if there's nothing, if the family's fighting or when certain decisions need to be made. Okay. This also legally protects you in any liability because in case, whatever's going on with the patient, let's say, um, if something serious going on and something happens and now the family wants to sue because they feel like the facility or the provider didn't made improper decisions on behalf of the patient. Well, guess what? Now you got that POA in place. So any decision that needs to be made, your staff, whoever, you need to go through that POA. It's going to be on them. Okay, and that's when you any communication with the POA, anything like that, you want to document that, and then in your EMR systems, you want to have who the POA is, have them assigned or in the contact POA. because anytime the patient goes to the hospital, anytime the patient goes anywhere, you still want to notify. They will, well, anytime they go to the hospital for a medical emergency, they'll be the ones to be notified. You might notify them on other matters. That would depending on what permissions the patient still gives. Okay. So, and let's go to the Illinois specific guidelines. Illinois offers a statutory short form for healthcare POA, standardized and widely accepted. Okay. They also do one for statutory, the property too, but the healthcare one is, of course, really the most popular one. Okay. For the POA, for healthcare and, well, at least for the healthcare one, the principal must be 18 years or older and of sound mind. Also, the same thing too for the statutory, the property one. POA documents must be witnessed. Okay. So, for the healthcare one, the only two people that are really going to be signing the patient one, it's one, or the healthcare one, sorry, the healthcare POA. So only going to be two people signing that one. The first person is, of course, going to be the patient themselves, the principal. The patient, again, they're in their right mind, they're able to make decisions, is saying, hey, in case something happens, I want this person to make my medical decisions for the healthcare. Okay, the healthcare POA also has a lot of some other things too, like it has a, a a question with a checkbox that says, in the event I need a guardian, this is the person I want to become my guardian. It has also a section on guarding quality of life, which is basically kind of like advanced directives. So it kind of offers the patient to outline kind of, okay, at the end of life, what do you want? Do you want CPR? Do you want life-saving measures? Do you want to be placed in hospice? Do you want comfort care, or do you want them to fight, do everything they can to bring you back? That's also in the power of attorney that you'll want to go through and fill out and talk about, um, have the families talk about with the agents and their family, the rest of the family, about those decisions, choices. Put that in the document because legally, the power of attorney will have to follow that document. Okay, so that's one of the great things about that form. It has all of that in place, kind of formatted, so the patient, the agent, and the family can all have a decision about or discussion about that, and the patient can make their decisions. Okay, um, so the patient signs. After the patient signs, there's needs to be a witness. Okay, so the witness usually could be anybody. It could be there's a few rules though, but really could be anybody, a family member, friend, as long as they're 18 years or older and of sound mind still. It could be a neighbor. It could be whoever the patient wants. Okay, really much. So it's up to the patient. Um, to witness, just like it's up to the BOPA, but you could be anybody to witness. Sorry, it could be anybody to witness. The only people who cannot witness, or I would say be careful about witnessing, is staff members. I usually advise staff members of the facility or providers for witnessing. I know some people do as common practice, case by, especially in the hospitals. I know sometimes it's just easier to do it that way, but usually it's recommended that staff members or any provider don't. I mean, unless the doctor sometimes like it's okay to do it because of the MD. But usually, um, especially for long-term care nursing home, it's usually recommended that you don't witness. You can get another patient or have them get a friend, which usually hasn't been a problem. Usually, um, let's say if it's the patient, maybe she shows her oldest daughter, so they might have the grandchild or the uncle or somebody witness. Usually that's not a problem. If worst comes to worst, if you got a witness, it's not be all. Um, just kind of make sure that the patient is constantly signing on free will. Make sure there's no conflict of interest. So like having the patient sign is gonna like create some conflict of interest with between that and the business. Um, which is why usually I say just be careful with signing. But if you have to, you have to. But you will need a witness. Um, and then some people do go ahead and do get it notarized too, which is also a great way to again safeguard it too. That's way uh, and safeguard the validity of the document. Um, so that's a great way too. Now, with the power of attorney for property, that one has to be notarized. That one has to be notarized. The power of attorney healthcare does not. It's recommended, but is not. But the power of attorney for property, that one has to be notarized. Okay. And then for the property of attorney one, staff members, facilities, healthcare members, you definitely cannot witness that one. If you have a notary in the building or a notary on staff, they cannot notarize the property one. That is a direct conflict of interest because of the revenue, the profit, the money. So you can't do. That's why I said even with healthcare, it can be a little bit iffy there, but with the property one, you definitely can't witness that one, okay, or notarize as well. But this property one needs notarization. Healthcare does not. And again, it's a very easy form to fill out. You can get it from Illinois free online, download it. You can fill it out in PDF or print it out and fill it out in handwriting. I always recommend social service staff or those who deal with customer service or business office or even admissions to have copies of these on file and make it part of your intake process as well, especially for long-term care facilities. Okay. All right. So, power of attorney and the role of healthcare staff members, we kind of touched on a little bit, but administrators, case managers, and social workers are often the first to identify missing POA documents. So, why is it important to have a power of attorney document on file? Again, the situation described, you have a long-term care. You got Barbara. She's been doing good for all these years. She unfortunately she has a stroke. Now she came back to the facility. She's not constantly able to make her own decisions now. Now you have all these medical decisions need to be made about surgeries and maybe two placements and whatnot. Now you might have the family involved who's acting a plumb fool, and now you get your staff member has to deal with the sister, the brother, the aunt who lives in Florida, the cousin who comes in and out. You got to deal with everybody. Okay, that becomes very stressful and opens yourself up to liability because okay, well, you have a power of attorney. This is the person who makes the decisions. This is the person we go to for this and this and that. And guess what? The patient made a decision. If any other family member has a choice, guess what? You have no say so in that. The patient made the decision. If they want to, okay, you can take it to the court system, take it through civil court. They'll deal with it there. Take it to family court. But legally, you will be safe and protected from liability because, hey, you have the power of attorney on file. The patient chose this. And guess what? If it's notarized, even safer. Okay, power of attorney should be a part of intake care conferences and discharge planning. Um, Start having conversations with this with your patients. Again, you don't have to be so totally involved. Like, don't help in like making decisions and get involved with any family drama. No, but just have a educational um, conversation with them. Like, hey, especially with long term care facilities. Hey, we're glad you're here. We're gonna take great care of you. But you know what? We want to start thinking about your advanced directives, um, and just your own planning. So, how do you want things to be in case something happens? Again, this is preventative. Okay, because by the time an emergency happens, it's too late. You can't do POA then because why? The person's not able to sign from a legal or from a medical or cognitive standpoint. So you want to do this while you got them and able to make decisions. Also, this is very helpful because um, guardianship can be very expensive for a facility. So if you have the patient who can identify somebody in their lives or close to them that in the event of a medical emergency, they can start to become the POA need be guardian. That takes so much liability off the facility as well. Because if the facility has to go for guardianship, you're looking anywhere from $5,000 to $10,000 just to do that. Where you could just do this simple process. Have the patient talk about it. They decide somebody. Okay, good to go. Okay. Have the forms printed out. Have it part of your admissions process, your patient intake, whether it be admissions, social service. Usually, social service does this. Education, but admissions too. You could be doing this education as well. This is risk management, so everybody should be doing this. Okay. EMRs should have POA documentation scanned and flagged. Upload them to your systems. This way, any nurse, any whoever has access to the system can see it. Usually, I know a lot of us use point click care and the miscellaneous or the documents. Upload it there and have it labeled healthcare POA, property POA. Have that labeled. And the emergency, the contacts for the patients. Have the POA listed as emergency contact. Number one, however you want it, or however the patient wants it, but make sure you have POA healthcare. That's the main one you really need. POA of healthcare. So that's why if they go to the hospital, if something happens, if they go to the hospital, you need to call the POA anyway, because the POA needs to be made aware. Hey, you were the assigned POA. They're going to the hospital, especially if they're unconscious. You need to be made aware because you might need to be making decisions, and then you want to document that. Any communication you have with the POA, document. Any discussions about any medical decisions, document it. Now this comes one if the patient gives permission, because if the patient is still able to make their own decisions, they still can say yes, it's my POA, but don't tell them everything or don't give them information about this or that. They still have the right to do that. Okay, but in the event that they goes from okay, they're not able to make decisions now to they're in the hospital, they had a stroke, their ultimate status, they're in a coma, whatever, then you need that POA document, and then you need to make sure that POA document gets to the hospital. Continuation of care. Also, the hospitals usually needs to make sure that the POA documentation gets to the nurse home. That's usually the biggest problem too. You want to make sure, but you want to make sure you have that as your EMR system because in the event, I'm not going to tell you how many times I've gotten calls from patients who have first gone to the hospital, they end up in the ICU and hospice, or something, yeah, a major decline, where they're not able to make decisions, and now they need a POA or they need to know who the power of attorney is, or maybe because of the crazy family dynamics, they need a central focus to focus on. I love it when I'm able to just say, "Here's the POA paperwork. Here's the assigned POA." Because of course the POA or the person, it could be able to say I'm the POA, I'm the POA, which is something a lot happens a lot in our field. Of course, the person that's whoever family members on the power of attorney, you're not the power of attorney just because you're the sister or the mom of the daughter. We're not. Do not take, and if you come across or if you come into your experience where you're talking with a family member, somebody they say their power of attorney, you need to see that legal paperwork. You need to see that legal paperwork. You want to see that the patient sign and that there's a witness. You want to see that, and then of course verify the patient. Hey, this paperwork was given to me. Is this okay? Because one thing I want to bring up with the POA, I forgot to mention the last slide. With the power of attorney for both healthcare and for property, while the patient is still constantly able to make decisions, at any point in time, the patient can decide to null and void the POA. So let's say, oh, sorry, excuse me. Let's say Barbara gave you the power of attorney healthcare paperwork. She wants her oldest daughter to be her power of attorney. Okay. She gave it to you Friday. You get in today, Monday. Barbara says, you know what? I don't want to be my power of attorney anymore. You can ask her why, whatever. She can say maybe I got into it, or like, or oh, you know what? We were thinking we're gonna do my sister. She'll be a better person. Once the patient tells you that they don't want a power of attorney, or um, that they don't want to use that power of attorney, it becomes null and void. So a power of attorney is only as binding as long as the patient um, is that wants it to be binding. When if there's an event that happens, um, where the patient might not be fully capable to make decisions, it still can be a little bit iffy because that doesn't necessarily mean that the patient's right to choose goes away. Usually at that point, then, depending on how major it is and how much of pushback there is from the patient, if they're undergoing a medical event, there's a medical decline that's affecting them cognitively, but they don't want to change POA. That's where family courts and guardianship might have to come into place. Uh, and then if you come across that, I would highly recommend to reach out to your ombudsman for long-term care facility, um, just to kind of get at least some mediation in place for that. Okay, because it's very important with the cognitive. So, power of attorney in terms of how to determine they're cognitively able to sign or not. Again, you want to use the BIMS of assessment, but this is where it really comes to um, kind of using your own good judgment and talk with the patient, talking with staff members if you can get those evaluations and whatnot. But again, this is mostly for the families to decide anyway. So this is why it's good to have those conversations while they're able to have those conversations still, because it's easier. Because once something happens, a medical event happens, or there's a decline, POA becomes really, I won't say less useful, but to obtain it would be less useful. So this is something that's a very good preventative measure you want to use and should be incorporated in the intake process. One of the things I do um, when I was working in admissions and social director is before the patient even gets there for the new referrals to new admits, hey, I'll say, hey, as the hospital discharge person or whoever, does the family member or the patient have a POA on file? Okay. Either I would say like, well, I would recommend they do that, especially if they're coming to a long-term care facility. Or I know when they get there, that's gonna be something I want to talk to them about. They have the right to say no and not assign one, but I also just think it's a good practice to just educate them on this. Hey, this is your right. You can do this if they want to. If they do, they do. They don't, they don't. I find that's usually not a problem. There are some people who, of course, just don't want to do it. That might come, especially if you have like younger patients or clientele. But definitely for my geriatric long-term staff, those who deal with the senior communities, usually this is definitely something you want to have, and usually I don't get very much pushback from it. Okay, but just a key point of that the power of attorney, the patient does have a right at any point in time to say, hey, I don't want them to be a power of attorney again. So if they come to you, that means that power of attorney becomes null and void. You can ask them to give them a new power of attorney to go and fill out and have witness and whatnot and bring him back or have you. But once that happens, you want to make sure you update your EMR systems too. Okay, I usually that can happen. Rarely I've really seen it happen for me, but just keep in mind that um, if the patient wants to change or revoke a POA, they legally are able to do that. A lot of times they do it again just because usually it might be somebody else. Um, might be somebody else who may be able to better keep up with the care of the patient, or maybe the initial agent they might often start coming up with health issues of their own, which is that's common what I see. The initial health agent comes up with health issues of their own, so they're not able to fulfill the duties needed of the power of attorney. That's usually common for what I see. So just keep that in mind. If that does happen again, it'll just be the patient will have to do a new power of attorney. But um, if it's in the murky area where they've already had a medical event or decline, they doesn't necessarily say they can't say that I don't want that person to be on the POA, but that's where you're going to probably want to have some more mediation involved, like ombudsman, adult protective services, other organizations like that, guardianship office, just to kind of help manage the patient's wishes. Because remember, the patient still has rights. The patient always has rights, as they should, right? Um, Ian Marshall had POA. Okay, EMR should have POA documentation and scan and flag. So label who the PR of attorney is in your EMR system so that staff knows when they're calling. Have the documentation loaded in the electronic chart, and usually I also have a copy at the nurses station too in the patient's chart, because again, in the event of emergency where you got a 911 situation, you might not have time to print, or your printer might be out. You could just go and make a copy or whatever have you. I usually will actually have a few copies of the power of attorney and the DNR in the patient physical chart just for situations like that. Okay. And then social services staff, usually they're the ones who keep up the people, whoever's keeping the PO documentations. You want to be doing quarterly audits on your POAs and guardianships to know who has POA, who has guardianship. Again, usually this doesn't change a lot, especially POAs, unless in the event that um, the initial agent, has some medical issues, you usually have to step down, which is common. But you always just want to do a quarterly assessment or audit of this. That's where you'll know, make sure you have all the information up to date and current. So in the case of the event of emergency, you're not contacting the wrong person and presenting a liability. Train staff on how to ask about POA in a respectful, supportive way. So again, this is a conversation that's usually I like to have right when the patient first gets there, where they have to do the intake work contracts, this and that, especially for long-term care facilities. Okay, hey, we're glad you're going to be here. You're going to be aging in place here, joining us. We want to help you make sure you have all your affairs in affairs in place. um, Talk to them about the POA documentation, the forms, why it's important, how it helps them, how it's giving the patient an active voice to decide how they want to do things. This is a great conversation too, just to have. I just call it the advanced directives conversation, because you're talking about the POA, you're talking about the advanced directives if they want CPR, they want to be resuscitated, or DNR. And then two, you can also talk about any burial or funeral plans and arrangements they already have. Have this all planned in place. Um, which honestly, I think for long-term care nursing homes is not really uh, um, a scary conversation. I mean, it's not a scary conversation to have. It's just that I don't see it happening a lot until it's too late. We want to stop that. Stop the confusion. Stop the family fighting. Stop getting the facility involved in all that. Have this plan up place um, so that if something comes up, the facility is protected, your providers are protected, and the patient's protected. Okay. Public health takeaway. Power of attorney is prevention. Power of attorney is prevention. Power of attorney is prevention. Okay. Prevention. This is a prevention tool because, again, one of the things that this is how I've always seen it come across it is the patient, something happens with the patient, they have a stroke or a heart attack, something happens, they have a medical decline. So now they're not able to talk like they used to. They have increased or in and out confusion. They might need all these medical decisions. Now you got to deal with multiple family members, which places the facility at risk because you might be listed to one family member who actually shouldn't have any authority or say so. It might go with them. It puts you in a very legal murky water, liability murky water. Okay, risk management, good risk management says, hey, let's tackle this problem hand on. You want to keep the facility, your staff out of it as much as possible. Keep it as only strictly as educational. Okay, intake when they first come in. Hey, I want to just talk to you about what the power of attorneys are. This is why they're important. It allows you to make your decisions, make a decision who can make decisions for you in case you can't. Completely voluntary to complete. Highly recommended. You can just share stories about why it'd be helpful. 9,010, especially with long-term care nursing homes, you're not going to have an issue with getting the patients to put this in place. Once you have that in place, make sure it's uploaded in your EMR system. So make sure they can see it, both the forms and that the whoever the POA is, make sure they're labeled in the EMR system so your staff knows. Okay, talk with the patient while they're still cognitively able about any permissions that they want to grant the POA at that time. A lot of times, once the POA, so I might get the POA paperwork established that, maybe the daughter's POA. I asked the mother, well, your daughter's a POA. So do you want us to also um, call it a form for any medical updates? Usually they say yes. Always ask for permission, but usually they say yes. Okay, like yes, I do want to keep up with my medical information because that's what the POA is supposed to do. You want to get permission for that. Okay, if the patient says no, you can't do it. They might say no. I don't want them to know anything, but keep them on the POA. You'll still legally have to abide by that. That's the patient's right. That's the patient's choice. You'll document that. If the patient says yes, I want my POA to be updated regularly on my medical affairs, my affairs journal, then yes, you would go ahead and put that in there. Document that and proceed forward. That's a great way too to keep the family member involved, to keep them involved in care. Okay. So that's why again, any medical emergency, you know who to go to, who to contact directly. No miscommunication, no confusion. Okay. You're going to want to be doing audits of this at least quarterly. Know who in your facility has a power of attorney, whether it be of healthcare, of POA, of finance, and or guardianship. You're definitely going to want to know for business office managers, those who do revenue. You're definitely going to want to know who the POA of finance is or property is if they have one. Okay, these are things that we can do to protect our facilities, protect the providers, protect our patients. Um, just unnecessary stress, liability, stuff like that. Okay, so that brings us to the end of the presentation. I hope you enjoyed this. You can find me on YouTube at Worley Consulting, where I do more of these workshops, trainings, and different things. This week, I'm actually doing a few more webinars too. So again, you can check that out on YouTube at Worley Consulting. That's EDWARDLEE Consulting. All right. Thank you for attending and hope to see you soon. Bye.